Hello and welcome to episode 14 of Pelvic Pain Unpacked. I have got a special guest with me, Judy Rossi. Say hello, Judy.
Hello, everyone.
She is a pelvic floor physical therapist. She owns Woodstock PT, right?
Woodstock Pelvic. Yes.
And what state are you in?
Georgia.
Georgia. We love Georgia. They're very supportive of our products. So Judy and I met at Pelvicon a couple of years ago, and she's been a great supporter of our products. But I just wanted to have her on the show, number one, because she does use our products in her practice, but because of her great success. First is a physical therapist, and then you transitioned into pelvic health. Is that correct?
That's right.
And you went to school in Long Beach, and I was in SoCal for so long. So shout out to SoCal. All right. So what kind of, I read on your website that you kind of had your own struggles, but what was really the impetus of you transitioning from orthopedic PT into pelvic floor PT?
So it was the fact that I had my own struggle, which was interstitial cystitis. So I developed that problem in 2017 and spent months and months going to urologists, and they tried different medications, which really didn't help. Bladder installations, which would help me for like 30 minutes. And then it would just be right back again.
Oh, wow.
So I ended up doing my own research and referred myself to a pelvic PT. At that point, I knew literally nothing about pelvic PT. I was just looking for answers. And it turned out that my pelvic floor muscles were really what the problem was. They were giving my brain a message that my bladder was burning, and I just had to go to the bathroom multiple times a day, multiple times a night. And it wasn't until I went through a few months of pelvic PT that the symptoms resolved.
And for those who might not know what an IC diagnosis is, it's kind of like you have this bladder pain and we've ruled out everything else. So
exactly.
you just have IC. And so it's like, here's a diagnosis, even though we really don't know what's going on.
Exactly. Yes. So only about 10% of people with that diagnosis have lesions in their bladder. And that's very small percent that actually really do have something wrong with their bladder. The rest of us, 90% or so, have severe pelvic floor dysfunction.
What are some of the biggest things about traditional healthcare that they often miss when evaluating chronic pelvic pain? And I think we kind of answered it, but what else? Do they get anything right? I should ask.
Not much. They don't ask, first of all. Doctors rarely ever ask anyone if they have, say, pain with intercourse or tailbone pain. It has to come from the patient. And there have been studies that have shown that the vast majority of women do not report those symptoms to their doctor because they're either too embarrassed or they think it's just normal and everybody must be experiencing this. That and incontinence is another one that women have been taught by all the ads out there about Depends and Poise underwear that, every woman leaks. So why would I even tell my doctor about this? It's not a problem.
Yeah, just go grab some at your store, your bulk store. Yeah, so I just want to highlight what you just said. So it was incontinence, pain with sex, tailbone pain. Those are the traditional ones that they get missed because the doctors don't ask and the patient isn't saying, hey, this is a problem. Is that
Right.
fair? Interesting. Right. And those all indicate, hey, there's something wrong.
Right. Something usually that I can treat.
So tell me a little bit more about dry needling and how is that different than when I think of dry needling, often acupuncture comes to mind, but it's going to be a little bit different. So how would those?
It's different. So the only common ground between dry needling and acupuncture is we use the same exact tools, the same needles. Acupuncture is based on Eastern medicine theory that I can't even talk about because I don't understand it. I'm not against it, and I know lots of people benefit from it, but I'm not trained in it, so I'm not going to try to explain it. But dry needling is more, I guess, Western medicine based in that we're looking for a trigger point in the muscle, which I've already explained. And when you insert a needle into the trigger point, you get what's called a twitch response, which can feel like a cramp. And then the end result is the dry needling relaxes the trigger point, which can then, of course, reduce the pain.
So instead of like putting pressure on it, you're actually almost stimulating it to.
Yeah, to contract. I almost liken it to hitting the reset button on a computer. Now, everybody's not a big fan of it. It is uncomfortable to have done, but when it works, people will say, well, I really hated it, but please do it again because it helps so much. And I feel like it's just quicker than doing a trigger point massage or pressing on it. It saves my hands to try to needle instead of push.
So what mistakes do you commonly see people making that are internet warriors, which is great because you should educate yourself, and then they try to self-treat themselves for pelvic floor dysfunction? Or have you seen people who are like, well, I was just trying to do this and now they end up in your office?
Right. Well, I could just use IC as one example. People who go online and find the IC diet, which has been pretty much debunked. It's literally such a huge list of foods that these people are terrified to eat hardly anything because everything they eat is on the list.
Oh, wow.
And so what the truth is that most IC patients have anywhere from 2 to 5 trigger foods or drinks that they learn that, okay, this is going to trigger my symptoms every time. I can stop that. But it's hard if someone's really upregulated and nervous and stressed and worried about their condition, that they're just set on this diet, that it just takes a long time to kind of unpack that and convince them that they probably don't have to do that. Another example that comes to mind is a lady who was referred to me for incontinence. And she said, well, I can't afford to come see you. And besides that, ChatGPT told me everything I needed to do. And I trust ChatGPT with everything.
Oh,
so,
no. I mean,
I love ChatGPT too, but they're not always right about everything.
ChatGPT, somebody even told me they were having a conversation with Chat, and the Chat had given them some information, and she's like, hey, that's wrong. And then Chat comes back and is like, oh, well, you caught me. Yeah, I was just guessing. And so people out there, full disclosure warning, like ChatGPT is only as good as the information that is floating out there. And sometimes, and I don't know if everyone knows that, but sometimes the information floating out there is just wrong.
Right. And you can ask the same question to ChatGPT 2 days in a row, which I've done before, and get a completely different answer each time. So it's not that consistent. And the other thing I get are people who try to just use influencers on Instagram or TikTok to learn how to do exercises, say postpartum exercises to close their diastasis, which is the separation in the abdominal wall. And then they wind up with me because they'll say, well, I tried this for months and it's not working. And I didn't know if I was doing it right. And they weren't usually doing it right. So it's just, it really is better to just seek out professional help before you go down that rabbit hole.